us understand the healthcare industry in India and Minnesota better, and figure out how we can partner together. And the first question that I'm seeing repeatedly coming up in these questions is the cost. Are the medical device companies in Minnesota doing enough to understand the patient needs in the socioeconomic context of India? What are some ideas that you can provide? And I think I'll have Mike and Barb and Dr. Paul address this question for us.
I think right now the companies probably are not doing. Here, okay? Okay. Probably are not doing enough to address the magnitude of the need in India. The fact is that most medical devices are developed for a global marketplace. That's primarily the United States, North America, Western Europe, those markets, and then they're sold around the world. And often they don't take into account the different costs, pressures that are present in those worlds, because those are, in many cases, very small markets right now. I think personally one thing that you'll see more medical device companies doing is taking advantage of, again, the engineering talent that's in India, because there is, I'm quite positive, there's a very different engineering mentality and mindset in India, which we haven't really tapped into very much, about the frugal designs and really kind of maximizing the design performance characteristics, where we often design for the 99.999% occurrence events. So it's a different way to design products, which I think ultimately will give you more.
The margins that companies typically have are really pretty high, 60%, 70%, 80%. I think what companies are going to need to do, sorry, this is doing something, they're going to have to look at getting into these marketplaces with lower prices, possibly lower margins, but when you look at the volume that you could have in a country such as India, even just getting a small percentage of that place, it's really worthwhile. And that's kind of the message we're bringing to our partner companies we're working with. Again, the margins might not be the same as you are in the U.S., but truly these are massive markets to go after, and I think that's what they're looking at, understanding a little bit more.
Thank you, Barb. And Saurabh, what would you say, we have these different stents and different devices, the medical devices that we have. Is there any more innovation that can be done so that they can be produced a little bit at a lesser cost for different markets?
Well, I'm an eternal optimist, and being an eternal optimist, the short answer will be yes, of course, we can do that. But just to put things in perspective, I just want to put some numbers on the table here. Recently, when I went to India, of course, I've been here in this country for way too long, and being so, in my doctor's opinion, I've been pasteurized for way too long. So when I went to India, for all my precautions that I had taken, I came down with typhoid. And yeah, painful as it was, but the recovery was pretty quick. So about a month ago, when I made a presentation to a team of executives who came to the University of Minnesota at the invitation of the President Kaler, just to put things in perspective, I put out a challenge to the medical device industry, is that for my entire diagnosis and treatment, the amount of money that I spent was $20. $20. Now, can we match that? Okay, now of course I understand that's the pharma industry. Medical device industry works in a different way. So that's the cost perspective. And also when I was meeting with the officials of the Indian government, I was very encouraged to hear that they had started this program. It's called CSR 800. What 800 means is targeting 800 million people, addressing the needs of 800 million people. And so these 800 million people, if you look at their gross income, that's a very sobering number. So to cater to those needs, we have to think differently. Our mindset has to change. our old paradigm of coming up with very sophisticated devices and building our sophistication upon sophistication, that doesn't hold anymore. I pose as an example, as a challenge, is look at our cell phones, the amount of technology a cell phone holds. And I'm sure the medical device industry can deliver upon those kind of promise and those kind of hopes.
Sure. And as we are seeing in computer devices in the cell phone industry, the things seem to be getting cheaper. The technology gets cheaper as the time continues to, as the technology continues to progress, as there are more and more things coming in the market. We can get the same cell phones that were pretty costly earlier. Now you can get for $20, $30. Is there any possibility of devices going that way at any near point in future?
Well, I just want to point out a couple of things. First of all, devices actually are getting cheaper. I mean, all around the world, the ASPs, the selling prices on all devices are going down every year, 5%, 10%, 20%, depending what market you're in. So prices continue to go down as volumes go up and technology matures. That's not it. This device industry is not immune from that at all. The one point I want to make, though, is that there's a lot of consumer examples we have, like cell phones, where prices are dropping. Well, they're just shifting the cost from the phone to your monthly bill, right? So the costs are moving, but you're still paying for it. The medical device industry doesn't have the luxury that if they went too cheap on the phone, your phone breaks, what do? You go back to the store, you get a new one, you throw it away. It's not a big deal.
Sure.
Pacemakers are a little stickier than that. So we have different standards, and so there will always be a different trajectory for this industry. You're never going to adopt things as quickly and see those kind of dramatic drops, but I think they are going down in price. It goes down all around the world constantly. It's just a matter of how fast it's going, and does the level hit a point where most patients can get access to it.
Great. Thank you, Mike. And I think moving away from the cost, the next question that we had is, how much is the medical device / defibrillator market in terms of dollar numbers in India? Anybody will have a guess on that?
It's probably $20 to $30 million at most.
At the most?
At most. Out of, then the whole the cardiac rhythm industry is probably about $6 billion, so it's very, very small.
Oh, okay. All right. And the next question was again on the cost. Are defibrillators / pacemakers affordable in India? But I guess there may not be too much of cost difference what we have from here to there. Any ideas on that? The question is, are defibrillators / pacemakers affordable in India? And how much does Medtronic's defibrillator cost in India as compared to US?
So I don't know the ASPs in India specifically. They are less expensive than the US. I think the big difference is on the question of affordability is most Americans have access to insurance, whether it's private insurance or whether it's Medicare. So if you have a cardiac condition and you go to a hospital and you need a defibrillator, either Medicare or Blue Cross and Blue Shield or Medica pays for your defibrillator and you pay a small copay. Since Indians largely don't have access to insurance, they have the same bill, but they've got to pay for it themselves. And so suddenly an annual salary's worth of defibrillator is a very dramatic expense. So I think the healthcare infrastructure and the system is part of the question of is it affordable or not. Even if the prices were lower, without that support network here in the U.S., people couldn't buy them either. They pay for themselves.
Well, thank you. Let's change the pace a little bit. And this is physician's question. So by 2020, India is going to be the diabetic capital of the world. What are the medical devices company doing to reduce the prevalence of diabetes globally? I wonder if that would be the medical devices or the physicians doing something about that.
The question is about obesity, and that's a lifestyle alteration for Indian people. Indians are genetically and racially not, their risk factors are totally different when we compare to Caucasian or European population. And I don't think medical devices has anything to do with prevention of diabetes, but what I feel is they need more of education and probably it should be physician mediated, and also probably integrated into college and educational systems.
All right, thank you, Dr. Roberts. And yes, Dr. Paul.
I'm going to stay on my eternal optimism path. And I can say that because my program is now actively engaged in coming up with medical device solution for diabetes, believe it or not. And we are on the threshold of making some very path-breaking innovation. So we are waiting for just a few amount of some feasible results, and if they pan out the way our hypothesis is working, I think we just might have a solution for that. Okay, but once again, I have to put a word of caution here. This is early in the game, and we all know some of the promises don't always hold up.
Sure.
But be that as it may, there are ways to come at it. And it comes from a very basic understanding of what the mechanisms are of diabetes. And yes, when we engage India, that's one of the area and common grounds that we'll be working on together.
Well, that's really good. I think that's a positive note that we need here. And again, a question on the cost, but I think it may be better put. Are there any challenges for the high-tech, high-cost items in the Indian market that you guys are seeing in today's world? When you go there with your high-tech, high-cost items, what kind of challenges do you face?
I think, again, it's going to be in select markets where they can afford it. Some of the areas where they're doing a lot of medical tourism, they are, touting the fact that their hospitals have all the latest technology, all the latest devices, so people coming into India will be getting those. I also think, and certainly what I saw and talking to a lot of people, there is a lot of wealth in India now, and I think those people will be demanding, the latest devices. They can go online and see what's going on in the medical community, but for the masses, no, it's going to be hard pressed to do that. So.
Thank you, Bob. And the next question is from the assistance from the state and federal government. What kind of assistance would you ideally seek of state and federal government to foster the India-Minnesota relationship in the medical industry?
Well, and again, this was my first trade mission with the Department of Commerce, and I know there's a number of service folks, the commercial service folks that are in India. They were very, very instrumental to us in setting up meetings with hospitals, physicians, distributors, getting an understanding of the marketplace. I think that's very, very beneficial for hospitals or for device companies. I don't think most people know that. They also vet these people, the distributors, so we know they're reputable, they will pay their bills, et cetera, and that's such a huge issue for device companies as they seek partners in other countries. So I think those are very good. I do think there is an issue pending, though, with high-cost devices. We heard when we were over there that the Ministry of Health in India has lowered the price of stents, I believe it's drug-eluting stents, to about $100, which is pretty low. For you, those of you who are physicians, you know what these costs on a here in the U.S. So I think there is, we need to have a good dialogue with the Ministry of Health in India to make sure they understand what these technologies are and why the costs are, why they are, et cetera, because that will preclude people from coming into this marketplace if they cannot, get paid for their technology.
Thank you, Barb. And another question on the medical side, with Dr. Roberts' presentation, the status of women in India, what interventions can a person in US do to meet the gap for the women in India and improve the quality of life of those unfortunate women in rural community in India?
That's a very good question, and that's the biggest problem, given the population of India and the fact that more than 70% of India is rural. Most of, as we know, most of the the new technology and high tech devices and hospitals and everything is kind of concentrated in urban in cities, and they cater to affluent and educated people, whereas the in rural communities, people tend to not even be able to get primary care. So even a small intervention like having these women get a pap smear, get a mammogram, will go a long way in preventing cancer-related mortality, which is very high in India. A small intervention like having them take prenatal vitamins when they are pregnant will prevent the development of birth defects. So these are small interventions. They are not expensive. They are in no way related to medical devices. They are not high budgeted, but they will have a very deep, profound impact on these women.
Thank you, Dr. Roberts. And I think what I'm getting, what my understanding till now from your talks and discussion that we had is that probably there is a different segment. There's a segment of population that may benefit from the devices, and there's a different segment of population that is probably still going to need a lot of development in the public health care, education, sanitation, and the basic medical needs that we're looking at. And moving on to the next question, are you aware of reprocessing of used medical devices, invasive and so-called single-use medical devices? Is it a viable and safe way of cost savings for hospitals and or patients? I don't think anybody would recommend that here, but let's see what the panel says.
We've actually worked with one of the reprocessing groups. There was one here, Sterimed was a Minnesota company. There's another company called Ascent Healthcare. Again, what we'd like to see is if a device is going to be reprocessed or reused, certainly cleaning and sterilization is critical, but making sure that device does indeed work the same way it did on the initial try. And I'm not an engineer here, but I do know that we had to in Australia, we had to get devices approved to be reprocessed, and we had to look at a lot of clinical data that was published on the use of reprocessed devices. So I think it's an opportunity for India, but again, not all devices can be reused. They should be tested before that's done in widespread use, and certainly the sterilization is critical to keep infection rates under control.
All right, thank you. And Barb, next question is for you too. It's how well defined is the device approval process in India? How long does it take on a typical device, and how is the process as compared to US?
Well, first of all, there's really not a device division in India yet. They're still working on kind of drug regulations. There's 10 categories of devices that are regulated. So that means there's a lot of devices that are not regulated. That is going to change in the next few years. There's pending legislation in India to do that. We did meet with the head of the device division of their equivalent of the FDA, and right now there's a lot of products you can get in the country with no regulation. I'd say a typical device, again, something what we would consider a 510K or a Class 2 device here, you could probably get those through in India in 3 to 6 months. In the US, that can take 9 to 12 months, sometimes longer, depending upon the FDA. So I think it's about half the time. Again, it has to do with the quality of how good the submission is to the agency. If it's a Class 3 device, you would have to do clinical studies in India to have that device come in. And then it's going to take longer, depending upon how long you have to run the clinical studies. So, but right now, there's kind of this window of opportunity to bring products in because they're not regulated. I'm just saying.
Okay, so the follow-up question on that is, what are the biggest 3 challenges of selling medical devices in India that you have faced, or anybody else has faced?
Well, I'm not sure I'll hit the top 3 for sure, but certainly awareness of the therapies is a big barrier. A lot of patients simply are not aware that there's treatments for the kind of diseases that they have, or they or in a rural setting where they don't have access to specialists that would know that, which is the second one. You asked earlier about some of the challenges for high technology products. As a comparison, the type of doctor that implants a pacemaker or defibrillator is called an electrophysiologist. We have about 2,000 or so in the United States. In India, we have maybe 30. For a country several, 3 times bigger than the United States, we have 1/10 the number of these specialists. And so other physicians do this kind of work. So there is a issue, and that's where, as the hospital infrastructure and healthcare system is built out, more specialists will come in and we'll have easier access for the patients to find these specialists in technology.
Great. And yes, Dr. Paul?
Yeah, I'd like to second what Mike just said. Okay, it's about awareness, and of course there's the resource barrier too, because anytime when you're delivering healthcare, the question then always becomes who is paying and who has the capacity to pay. And some of the hospitals that I visited in India, some of them have different cost structures addressing different needs. For instance, when I went to the Manipal Hospital in Bangalore, they have tiered payment structure for people who can pay for specific healthcare needs. Okay, they can even charge them up to $130. For people who are not able to pay that much, okay, they can give it for $30. And people who really cannot afford to pay, they give it for free. So there are those hierarchies, and within those hierarchies, of course, okay, when you are using a medical device, I'm going to touch upon some of the previous questions too. And it was a very telling comment that I do remember from my days from St. Jude Medical, when we were doing some trials at Harvard. So one of the physicians who was doing this trial, who was looking at all the facilities that we had to do some of those trials. And so look at all this equipment that we have. But if you go to a developing country like India, you won't even have that basic facility, the basics of the basics. Okay, so the facilities also become a challenge. So how can we bridge that gap? And I'm going to go back one more question that you posed. So how can the institutions here, both the government and independent institutions, how can they help? Okay, so to answer that question, the way I would approach it is to first assess what is needed, what is the gap, what is lacking. What is lacking in India is the basic infrastructure. The basic infrastructure for innovation for medical devices. They have gotten some kind of a handle over the pharma industry, but medical device innovation and infrastructure is completely missing. Had the good fortune to go visit some of the national laboratories in India, and yes, innovation happening in pockets, silos, but there is no concerted effort how to bring it together. So the reason why University of Minnesota program got chosen to be a partner in all of this is it all begins with, like Mike said, awareness, and awareness leads to education. So University of Minnesota, this program, as it's training some bright fellows and bright minds to come up with innovation, we can translate the similar kind of knowledge to India. Already institutions like Stanford have taken the lead to start that kind of a collaboration. And that collaboration has borne some fruits, but they want to make it even bigger. So they are looking for a consortium of universities, consortium of education institutions, consortium of medical device industries who can partner together, because at the end of the day, everybody wants a win-win solution, not a competition, a win-win solution. So so the task that has been put on my plate, and this is where I've been talking to Mike about that, and thank you for your support, Mike, on this, is that we are trying to come up with a proposal together that we can present to the Indian government how we can take this thing further. And of course, we can request help from the government entities here, because whenever you start something together, funds become a challenge. And the Indian government has made it very clear that they are willing to put up funds. So now the request now is with us here, how to solicit those matching funds, because for a win-win solution to happen, collaboration to happen, both parties have to come together. So thanks.
Thank you, sir. That's a lot of information and very interesting information that we need for developing the future. And the next question is on the same lines. How do you balance the trend, or if there is a trend, to innovate devices in countries like India, which you were just talking about, and selling to countries like US versus selling devices developed in the US to the countries like India? And is there any maturity in the market of the local Indian manufacturers in making devices?
Yeah, I would say that the Indian medical device market is very immature. There's very few companies, and they're basically providing some very basic devices. I think that you asked about the trend. I think you have to put the engineering teams actually in India working with Indian customers in that ecosystem to see how things should be designed to build products that are suitable. I think as we've seen in other industries, those products may come back to the U.S. or other developed markets, and they may find a niche there as well, or even more than a niche, they may find a broad following. But I think there's a lot of maturity yet to occur in that industry in India, and I think that we'll see more multinational companies establishing themselves there to get access to what those customers need and build better solutions for them.
Great, thank you, Mike. So you have some comments?
Yeah, as a step to that, okay, it's very clear that the Indian market has a need, but there has not been any concerted effort. There's no infrastructure how to promote that. So it all begins, like Mike said, with awareness. And to generate that awareness, even as of this month, we were planning to make a trip to India to do what is called the clinical immersion, to first see what is needed by the Indian hospitals, by the Indian healthcare system, because our awareness begins there. Because whatever healthcare system we are exposed to doesn't really hold in back home. The system is totally different. So once you go there, you get a feel for what's needed, then only you can come up with solutions to address those needs. And also, having talked to Mike and other executives from other local industries here, we also get this. Correct me on this, Mike. Is that there is not just the issue of trying to export products over there. There's also this new mindset of trying to create human resources in India, create some expertise. So when multinational companies like Medtronic, Boston Sci, St. Jude, and others who go to India and they create their own centers of excellence and their own satellite offices over there or satellite corporations over there, they have a pool of talents that they can bank upon and bring them in under their roof, create some innovative products, and then compete worldwide. Mike, if you'd like to add to that.
All right, well, thank you. Thank you very much, my panelists here. I think we are coming to the close of this discussion, and I think we pretty much touched on most of the questions that audience had asked. There are some variations on the same topics that we have touched, and I'm really glad that I could be here to listen to you guys and understand about this medical device industry and the future that we have in India and the partnership that we can bring to US and India. Now I'll have you guys give us some closing remarks, and we'll start with Mike, and then we'll move down.
Well, thanks. Again, I think there's a lot of opportunity here for continued partnership. There is a large unmet need in India. There's a large market. There's all the trends of the economy going, and everyone demanding higher quality healthcare and better access to healthcare. And there's a lot of very talented people in this industry that want to deliver those solutions, whatever those right solutions are. So we're going to see, I think, more and more engagement with the medical device industry globally, in India locally, what those market needs are, and then what solutions should be built. And as Dr. Roberts said, it's not always going to be a medical device. I mean, we're not going to really, prevention of disease is not usually a medical device focus. It's usually interventional procedure or medication. But when there is a treatment that's required, that is implantable or lifetime treatment, that's where the devices need to be designed appropriately and then delivered to that system.
Thank you, Mike.
Well, again, I wanted to thank you all for sitting and listening to this. It is an exciting topic. Our company is really focused on, it doesn't have to be even major devices. I think some of the things we saw over there were things like ACE bandages, just not of good quality, and things that they could help, like lymphedema and things like that. So any of you in the audience, certainly that's interested in this area, would love to have a conversation afterwards, because I think there's such a great need for a lot of things. It doesn't have to be the most expensive things. It's just basic things. And if you know people over there that need product, we'd certainly love to hear from you. Thank you.
Thank you, Bob.
I would again thank the India Association of Minnesota for giving me this opportunity to be a part of this very interesting panel discussion. I'm kind of out of league with the medical devices, but still I hope I was able to throw in some light about the current situation, especially in women's healthcare, and I hope there are some volunteer organizations in Minnesota which probably could do some good work there and help us to take care of our patients back home. Thank you.
Thank you, Dr. Roberts. And Solid.
Thank you all for being so patient and inviting me over here. And it's been a great privilege to be a part of this panel. As I'm engaging in this kind of discussions, I chanced upon a presentation that was made by the Surgeon General of India in 1913. At that time, India was under British rule. The population of India was almost like that of what the United States today. And the first opening line of his address was, the healthcare system and issues of India are very complex. Now, that was 1913. So imagine what it is like today. So I don't want to trivialize the task at hand, and I cannot even be so presumptuous as to say that medical device has all the answers. Yes, it begins with awareness and daily lifestyles, as Dr. Roberts said. But these discussions do take our journey one step ahead. So thank you very much for hosting a discussion like this. It's certainly generous awareness. And thanks for welcoming me.
Thank you. And thank you for being such a great audience. And let's give a great hand to our panelists here. Thank you. And Sunoj?
So thank you, Dr. Aggarwal, for your moderation on that great panel discussion. Now I would like to invite Kusum Gosain and Nag Bomareddy to the stage for the presentation of the plaques to our panelists and our moderator. So first we have Dr. Saurav Paul. Next, we have Dr. Suja Roberts. Next, we have Barb Peterson. Next, we have Mr. Mike Hess. And last but not least, our moderator, Dr. Rajiv Aggarwal. So can we give one more round of applause to the panelists and our moderator? So thank you again to the panelists, the moderator, Consul General for joining us this evening and making this night a true success. Without you, none of this is possible. But actually, as Kusum said, the IAM Fund does not stop here. So we have, Festival of Nations coming up in May, and then we have the large India Fest in August. So I hope you can all enjoy us there. So this concludes the evening. The bar, I think, is now open, or has been open for a while, because I can see some drinks out there. So please stick around and mingle. And I want to thank you all again. Hope you all have a safe drive home, and thank you very much. Good night.